Good morning, good afternoon, and good evening, everyone, and welcome to another edition of JAX Live. I'm your host, Danielle Fontaine, Strategic Insights and Innovation Senior Analyst at the Jackson Laboratory. Today, I'm pleased to introduce Dr. Andrew Schile, Senior Scientific Advisor. As a quick reminder to our audience, please be sure to use the comment box to submit your questions, add a comment, or just send us a shout out from wherever you're watching today. We will answer as many questions as possible at the end of our discussion today. So to start, today's live stream is about NASH models. So Dr. Schile, can you just tell me a little bit about what is NASH and how is it diagnosed in humans versus mice?
Yeah, I'd be happy to explain that. So NASH is non-alcoholic steatohepatitis, which is a severe form of non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease includes a variety of different diagnoses that together make up the most common type of chronic liver disease in the United States and many other countries. So in many cases, non-alcoholic fatty liver disease is a relatively benign disease with few clinical symptoms other than the accumulation of fat in the hepatocytes within the liver. But for some individuals, particularly those with obesity, type 2 diabetes, and metabolic syndrome, this can progress into a more severe form of NASH, which is associated with inflammation in the liver, as well as fibrosis, so scarring within the liver. So this will commonly be diagnosed in people in part through the use of some different serum markers, serum or plasma markers. So when the liver is damaged, it can lead to the release of different liver enzymes like ALT and AST into the bloodstream. And so in some cases, those can be diagnostic of NASH. But really, the key diagnosis is frequently made with a biopsy or some other type of imaging of the liver to confirm the presence of inflammation and fibrosis. So many of the different mouse models that exist reflect some of these different clinical signs or pathology signs as well. So for example, in some of the key, say, diet-induced models that we'll talk about in a few minutes, you can see the, say, for example, elevations of cholesterol or triglycerides, which might be reflected in a lipid profile of somebody who has NASH. But really, the key diagnosis in mice is often the same as it is in humans, and that relates to the pathology of the liver. So whether it's a terminal procedure at necropsy, for example, in a cross-sectional study to look at liver histopathology with scoring, or in a biopsy, for example, these are probably the key ways in which NASH is diagnosed in the different or monitored in the progression of NASH in these different mouse models.
Great, so you're saying different mouse models. I've heard that there's not really a perfect mouse model for NASH. But I know JAX has several different models that have been used in NASH types of research. So can you tell me a little bit about the models that are available?
Yeah, I'd be happy to, because anybody who's looked at a review of rodent NASH models will know that there's kind of a bewildering array of different models that are in common use, right? So, but I would say that broadly speaking, the different models fall into two broad categories. So there are those that are induced through some kind of a chemical intervention, and those that are induced through a dietary intervention. So the common chemical interventions might include something like streptozotocin, which when administered to mice can lead to depletion of the insulin-producing beta cells in the pancreas, which can in turn lead to the progression of type 2 diabetes-like symptoms, which, as we know, is a major risk factor for the progression into NASH. So that's one chemical intervention that's commonly used to promote NASH models in mice. Another one might be something like carbon tetrachloride, which is directly hepatotoxic. So it can lead to some of the liver histopathology signs of NASH when it's administered into the appropriate mouse strain. So those are the kind of common chemical interventions, but there are a few different dietary interventions that you'll see referenced in the literature and elsewhere. So one of them might involve a deficiency of a key nutrient or amino acid, such as a choline deficient or methionine deficient diet. And so these in many ways can also be hepatotoxic and lead to the progression of NASH-like phenotypes. We'll talk more about those in a moment. But another common dietary intervention involves a diet that is high in fat, fructose, and cholesterol. So in that way, it kind of mimics some of the diets that are known to contribute to the progression of metabolic disorder and obesity and diabetes in the human population. And so it's worth mentioning here that strain selection can be very important for NASH models, like it is in so many areas of mouse disease modeling. So commonly, the dietary interventions or chemical interventions like streptozotocin, at least, will be administered to the C57 Black 6 inbred strain. So this, of course, is the most commonly used inbred strain that happens to be susceptible to a variety of diet-induced metabolic models like diet-induced obesity, diet-induced NASH. It's sensitive to streptozotocin, et cetera. But so that's one common inbred strain that's used. But there are other newer or emerging models like the MS NASH mouse, which was produced by intercrossing C57 Black 6 mice and AKR mice, and then selecting for metabolic phenotypes. So in a strain like this, while it's considered inbred, is a different inbred model from, say, for example, the C57 Black 6 strain. And what will happen in a mouse like the MS NASH mouse is that you can have progression into non-alcoholic fatty liver disease and NASH-like symptoms that's exacerbated with diets that are high in fat, fructose, and cholesterol. But just by virtue of its genetics, you can see some of these characteristics developing on a standard chow diet as well. So in addition to these kind of strain selection issues, like the choice of the appropriate inbred strain to use, there are other genetic models as well. So a model that's commonly used in the literature involves mutations that affect the leptin signaling pathway. So principally the satiety hormone leptin, the OB mutant mouse. This is commonly used in a lot of different areas of metabolism research in mice. And so what this can help to promote is glucose intolerance, dyslipidemia, especially if it's fed a diet that's high in fat, fructose, and cholesterol. So you have the choice of the type of intervention, whether it's chemical or dietary, or sometimes it's even both. So for example, there's the STAM model, which involves administering streptozotocin to neonatal Black 6 male mice and then weaning them onto a high-fat diet. That involves intervention from the dietary as well as the chemical component as well. And so, so I think that in large part addresses some of those issues about strain selection.
Great. So you've mentioned genetics and strain selection. What are some of the other considerations that you think are pretty important when choosing a mouse model for NASH?
Yeah, so there are a couple of different factors that are worth considering. And I think principally that would include what features of the NASH phenotype do you want to see reflected in your model? So I mentioned earlier diets that are deficient in choline and methionine, right? And so so what you can have happening with those diets, depending on the diet, is you can have a relatively rapid progression of liver histopathology signs. So for example, you can have within a matter of weeks to just a matter of a couple months, you can have development of severe steatosis, inflammation, and fibrosis. But this is all happening against the backdrop of a mouse that is not gaining weight. In fact, frequently it's losing weight. It'll have low blood sugar. It'll have low cholesterol, low triglycerides, low insulin. So you can have a model that will, for example, might reflect some of the histopathology signs of NASH in the liver, but you won't have that component of the sort of metabolic syndrome or obesity or diabetes like you might expect to see in an individual who's maybe been diagnosed with NASH. So another key consideration to think about on the genetic standpoint is, frequently you'll see use of the OB mutant mouse, which is a valuable tool, or something like streptozotocin, which is also a tool for helping to induce diabetes or metabolic phenotypes in mice. But these, of course, are not underlying causes of NASH, clinically. So you sort of have the aspect of, the key phenotype that you want to look at. So whether it's, you might choose a model based on its liver histopathology profile, or maybe you want a model that is showing some more signs of metabolic disease in addition to liver histopathology. And so it's also worth mentioning that many of these chemical and dietary interventions begin using young male Black 6 mice. But this kind of overlooks two key aspects of NASH epidemiology, namely that age is a major risk factor for NASH, and then also that while men are overall at a higher risk for non-alcoholic fatty liver disease, there's some evidence showing that women over the age of 50 are particularly at risk for progression into severe fibrosis. So you can see some of these models being induced in young male mice, but they may not reflect that epidemiology of the human disease. But what we found in some recent research that we've done at the Jackson Laboratory is that if you take one of these common dietary interventions, so for example, a diet that's high in fat, fructose, and cholesterol, and you start feeding that to an aged mouse that's at a life stage that approximates a common age of diagnosis in humans, so a mouse that's about 12 to 13 months of age roughly corresponds to a man or a woman in their early 40s. So if you start feeding an aged mouse this same diet that's commonly fed to young male mice at 6 weeks of age, you can find that the aged mouse will develop more severe clinical signs of NASH. So whether it's serum markers or, for example, some of the liver histopathologies in much less time than a young male mouse that's fed the same diet. So frequently you'll see the use of, young male mice that have been fed this diet from 6 weeks of age, but it can sometimes take 6 to 9 months for the severe phenotypes to develop. But you can see these developing more quickly if the model is created using an animal that's at a life stage that's approximately equivalent to common diagnosis. And an interesting follow-on to that is that we see comparable pathology and clinical markers developing in aged male and female mice. So whereas young female mice are typically resistant to these diet-induced metabolic models or NASH models, we find that the aged females are sensitive to this. So those are a few different factors that might come into play when selecting a model.
That's awesome. So one of the things that I've heard you mention a couple times now is that sometimes even these young mice have to be on diet for quite a bit of time. Alternatively, you can put these aged mice on a diet. Both of those things would take up a fair amount of time. Are there ways that can be used to kind of speed up that progression to NASH or to get a NASH model a bit quicker?
Yeah, that's a very good question. So having a ready supply of aged mice available would certainly accelerate that timeline, right? So you wouldn't have to wait for a young mouse to become older before you start that kind of dietary intervention, high fat, fructose, or cholesterol. But over the last few years, we at the Jackson Laboratory have worked to establish very large colonies of aged C57 black 6J male and female mice. So they'll be aged up to 90 weeks of age. And so there's a variety of different, ages that are available that mimic different or that reflect different life stages of the mouse, which could be helpful if you want to try to introduce some of these models at different life stages to try to maybe mimic this, the known risk factor that age represents in the progression of NASH in people.
Well, that's great. And you mentioned that the Jackson Laboratory has this large inventory of these aged mice. So is JAX able to execute studies in-house or test reference compounds for researchers in their facilities?
Yeah, so our in vivo pharmacology team has experience with a variety of different metabolic models. And so if you are interested in for example, a compound efficacy study in a NASH model, whether it's a dietary or chemical-induced model, by all means, feel free to get in touch with us and we can discuss model selection or the feasibility of any study design you might be considering.
Great, and that's actually a great segue. We have a couple questions coming in about how that NASH phenotype can be measured at JAX when we're doing these types of studies. Can you talk to that? I know you mentioned it a little bit at the very beginning, but how would we measure that at JAX?
Yeah, that's an important question. Is you want to be able to have good sort of in-life or pathology metrics for monitoring disease progression. So one of the common things that we'll do in some of the natural history studies that we've undertaken to kind of compare and contrast some of these different models, whether it's a model that's in the literature or sort of an emerging model like the MS-NASH or the aged mouse models, is you can do periodic blood draws for serum collection from conscious mice, and you can follow longitudinally over time how key markers like the liver damage markers, ALT and AST, how those progress in response to treatment or how they evolve over time in the natural course of disease development in some of these different models. So there's the serum markers. Obviously, you can include other factors like measuring body weight, but as we know, one of the key phenotypes to look at in this, or the key endpoints, is the pathology of the liver. So assessing the key factors like steatosis, inflammation, fibrosis, necrosis, and assembling things like cumulative scores, which are kind of like a disease activity index for NASH. So those can be monitored either in a kind of cross-sectional way where you have periodic necropsies at different time points to look at tissue pathology, or increasingly what you're seeing now is the use of biopsies, right? So you can sample from a mouse that remains on study a piece of the liver for liver histopathology. And I think one of the exciting new directions that I think we'll see becoming increasingly used in the mouse models might be some non-invasive imaging techniques. So clinically, ultrasound and other imaging techniques can be used to assess how the elasticity of the liver changes as fibrosis develops. And so what I think we'll see happening increasingly is that this kind of imaging method being adapted to the mouse models, if it proves to be feasible, and then you'd have a way of imaging the liver to understand how fibrosis, or perhaps even other aspects of the disease in the liver, progress.
That's great. And so another question that we're getting is, you've mentioned a couple of times some of the internal studies that we're doing at JAX, like those natural history studies. Where will that data be? Will researchers be able to see that internal JAX data for these studies?
Yeah, so one of the exciting things is that a lot of these studies that I just mentioned to you are brand new data sets that we've collected here at the Jackson Laboratory. So what we're doing right now is we're working to put the results from these different, not only the life history studies, but also some reference compound validation studies. All of these data will be made available via our landing page for NASH resources, which, if you're unable to find that, by all means get in touch and we can show you where that is. But we'll be putting all these data up there to aid in selecting models, maybe choosing the most appropriate one depending on what your disease endpoints are. If there's something related to inflammation that's important to you, you might want to choose one model or another. So we are putting all of these data on our landing page for you to look at.
Fantastic. Thank you so much. And with that, unfortunately, we are out of time. If we couldn't answer your question, we will follow up with you. And if you have any other questions about mouse model selection, please reach out to us at micetech@jax.org. So thank you all so much for joining us today. And thank you, Andy, for the great discussion.
My pleasure. Thank you, Danielle.